In 2015, a group of 4 family doctors and 4 psychiatrists came together in Victoria, BC, to try to figure out how to address the mental health crisis in the province and beyond.
Counseling resources are thin. Primary care teams have counselors, but the wait list is often months to see them, and they often will see you once or twice and then try to send you off somewhere where you could pay for it because they just don't have the resources.
Through collaboration with each other, they came up with this idea. It initially was called CBT Skills Society, and we saw that we were offering more skills than cognitive behavioral therapy. Hence, we rebranded the name to Mindspace to encompass what we offer, which is beyond CBT skills. The program is an 8-week course that's offered to patients with mild to moderate depression or anxiety, and it's evidence-based strategies so that patients can start to be more empowered and more in control of their own mental health needs.
What the group medical visit does is it brings people together and teaches them about how their brain works, but also there's an opportunity in that group setting to recognize their common humanity. I started referring a few patients to the program, and a few of them came back and said it was the best thing they'd done in quite some time.
To be able to be in a situation where you're meeting other people, because that's the biggest thing is when, especially with depression, it's the last thing you want to do. When I met the person that was leading it and realized she was very understanding and everybody supporting everybody, it made me feel better about myself because there was no shame. I was actually quite glad that it was a Zoom process because if it had been an in-person, I probably never would have went.
When we traditionally started this program in 2015, it was in person. And then in 2020, with the pandemic, overnight, we switched over to virtual. I was surprised, pleasantly surprised at how much connection was still there and available, even in the virtual care setting. It also took away a lot of barriers like accessibility, transportation, the anxiety of coming to a in-person group. And now we offer both virtual and in-person. A patient will come through and they will have 12 to 16 hours of physician time. That costs the system the same as if a patient came and saw us in the office 4 times for 10 minutes. So, that's 40 minutes versus 12 to 16 hours. So it's a huge cost saver for the system.
There are amazing projects being done throughout the province, and this one is an excellent example of quality improvement that was able to be shared and spread across the province. And JCC is the perfect platform in order to allow that to happen.
In my mind, the JCCs are not only about what do we do in medicine, they're evolving into what are the actual pieces that are affecting the health of my community, health of our physicians, health of everybody, and how can we actually do something about it together?
So that shared care funding has been so invaluable in so many different ways to be able to improve patient care, to be able to enable physicians to be able to work on something we are dedicated to and to be able to create systemic change, as well as to be able to fund physicians in our own mental health and well-being. And therefore we can, strengthen the system from within.
Doctors should suggest things like that to their patients because the patients don't always know that these exist. And so to have that opportunity, I do appreciate it. I do think it helped, and I think it could help other people.